So Marta and I began a collaboration. We were both individually working on different areas of contracting for nonprofits. And so this paper represents a collaboration of both of our work. And what we're trying to look at is what a lot of you have already spoken about, this new phenomena of local governments contracting. What we've been trying to do with this collaboration is we've noticed that there's been an increase in local pilots looking at contracting out social services to nonprofit organizations. So these happened as early as the late 1990s, early 2000s in places like Shanghai, but they've rapidly spread. And so what we are going to look at then are some of these local experiments. And the reason that we think that they're important, the reason that we think that we should investigate what's happening, that this isn't just a source of funding, right, but that something larger might be happening here, is that contracting to civil society organizations or nonprofits, we use these terms interchangeably, might do three things. And so one thing that we're really interested in is that it might create more social innovation. So for example, if you think about a government policy to provide something like elder care, oftentimes this is a one-size-fits-all policy, right? So you have an elderly population that needs care, you're a government, and you build nursing homes, right? Instead, what we see with contracting is that in addition to the creation of nursing homes around the country, we also see that a lot of nonprofits who are contracting out elder care come up with much more targeted services, right? So they create social innovation where they develop services like twice-a-week bathing. That's the name of one of the services that they offer. And this is really important because their research has shown that most of the elderly slip out in the bath, they break a hip, and this then has a major spike in mortality, right? So this is actually a really, really good service to offer to the elderly community, but it doesn't cost as much as building nursing homes, right? So we see social innovation might be a really important result of contracting. We also see that improved policy making might also be a really important result of contracting, in that if contracting to nonprofits or civil society organizations who are principled actors, right, they're involved in their communities, they're embedded in their communities, they're advocating on behalf of their communities. So if they all of a sudden have access to the policy making process, whereby whatever social innovations they're trying out can feed back into government policy itself, and change that policy, that might also be really beneficial. And then last, and this is very early to say, we might also see that there's more development of the civil society sector, right? So if you think about diversified funding sources, and if you think about increased ability to run projects and pilot programs, this could build capacity in the civil society sector as well. We don't have a lot of information about the last one, of course, so we're mostly going to try to talk about the first two of these. And so what we're trying to do then through these two case studies that we're examining is we're trying to figure out if in fact these civil society organizations, when they contract with the government, do they engage in social innovation? And does the government have a way, an institutionalized way, to capture that social innovation or that knowledge and feed it back into the policy process? So that's what we try to look at. And so we're going to look at two case studies. So in my research, I'm looking at migrant education in Shanghai, which a few other people have spoken about as well, including Jennifer. And then Marta's going to be looking at HIV services in Yunnan. And these turn out to be very good comparative cases. I just want to briefly preview our findings. We'll talk about both case studies, but a brief preview of our findings is that what we see so far with contracting is that there tends to be levels of dependency formed between the civil society organizations and the local government, right? So what we tend to see is rather than that diversification of funding that we were looking to see, instead what we see is that organizations either have the majority of their funding from international sources or the majority of their funding from the government, right? And they seem to be following the lead of whoever is providing the majority of their resources. We also find that there doesn't seem to be any sort of incentive built into the contracting process for social innovation. So a lot of the contracts are built around providing a service and not about trying out new and risky innovations that might actually result in failure, but this failure then could be captured and it could be used for future policy making. So we don't see a lot of incentives for that type of social innovation process. And then we also, unfortunately, at this point, don't see a lot of feedback mechanisms. So we don't see any sort of systemic way that the state captures the contracting experience and feeds it back into the policy process. Instead, it seems to be a one-way street where the government contracts the service, the organization provides the service, and that's it, right? So what we're going to do is look at both of these cases, but we also want to end on a slightly hopeful note where we have some policy recommendations about contracting could still provide these things. The system of contracting needs to be changed. And the good news is that we're still in the pilot stage where a lot of localities are trying different pilot programs, and we don't really see a national level contracting system. So there's still time to adopt our recommendations. So the case that I looked at then is migrant education in Shanghai. And so this is basically the creation of private schools to offer education to the children of migrant workers who, because they're not registered in that area, don't have access to the public school system, right? Most of you are familiar with this. And we see that this was piloted in Shanghai fairly early, and so this is the case that I look at to try to understand how contracting has changed over time in Shanghai. And basically, the model in Shanghai is that you have nonprofits, or I guess I should call them NGOs. These are migrant NGOs. They provide a whole suite of services to the migrant community, and this education service is one of them. You also, though, have private schools, and in China, private schools have been around for a while, right? And they provide services to anyone who can't be in the public school system. So you have both of these types of providers contracting migrant education from the local government. So these are the two types of organizations, and obviously they have different motives, right? As far as the reporting relationship, most of these organizations are registered with the Social Development Bureau, and they receive their funding from the Finance Bureau. However, they're inspected by the Education Bureau. Okay, so 3 different government agencies that they have a relationship with. Now the inspection, because this is really the key point, right? If we're thinking about how does the government interact with the nonprofits they're contracting with so that they can capture the experience of the nonprofits, this should be a really important step. And what I find is that, I've detailed it out here, but basically there's an annual review where the Education Bureau visits the schools and they collect this sort of information. And so with these review teams, they interview students, they interview teachers, they sit in on classes, they examine the curriculum. They also check the books. And most of the schools that I talked to said this is actually what they really seem to be interested in, right? More than any of these other things. And so unfortunately what I found through most of my interviews is that this occasion where there should be a capture of feedback, right? Talking to the teachers about what's working, what's not working, where are there gaps in the curriculum. This information is not captured, nor is there any interest in capturing this, even if it's offered. And instead, this really is a pro forma, check off the boxes, make sure we understand the number of students, which will correspond with the amount of money that we give the organization. So in a way, this is, thank you, in a way this is really good because we're seeing that more education services are being provided to a community that's underserved, right? So this is a positive thing. However, on the other hand, if we're interested in this policy feedback, this is what we're not seeing. So at this point, I'm going to turn things over to Marta to talk about HIV services in Yunnan.
So the second case study that we have, it comes from the HIV sector. We believe that there are 3 reasons why HIV sector might have lessons for outsourcing in whole China in general. The first reason is that there has been over the last 10 years the rapid growth of the civil society in HIV sector. And at last count it was 1,500 HIV organization. That was MOH, Minister of Health data. Obviously, it doesn't seem that much, but among the prominent sectors, I think this is quite a lot. The second reason is that there is an extensive experience in state non-profit collaboration and joint service delivery, especially at the local level. And that's again over the last decade when there was an intensive fight with HIV and AIDS going on in China. And over the last 10 years, there were very different models that emerged of the collaboration between state and non-profits, and they were very much shaped by being pragmatic, how the money is flowing. So there were programs by foreign donors that actually left some autonomy to CSOs. I'm not saying foreign donors are angels. I have worked for foreign donors' money. I think we also imposed our agenda on the CSOs quite often. But I know of programs that actually leave some space, and the CSOs are able to respond to the needs that are coming from the community, or sometimes even encouraged. There were also other models, like, for example, global funds, that were quite restrictive on how the CSOs were using their money and setting their agenda, because the money was basically flowing through the government. And then we also have quite a lot of pilot social service outsourcing going on in China in the sector. And that's at provincial, and county and city district level. So there were very different models of collaboration. The third important reason to look at what kind of lessons are emerging in the HIV sector is that at the moment, as you know, the foreign funding is ending really rapidly for the CSOs, and that's extremely rapid in the HIV sector. The Global Fund is ending in September 2013, so this is as we speak. And the central level authorities have already stepped in, and they said, we are going to pick up the bill. We are going to fund all these CSOs and HIV response in China. And as we speak, they're trying to figure out how they're going to do it, and they really need to do it fast. So again, I think some bets are in order. Are they going to do it or not? And they really need to act fast. And it seems like, particularly in this sector, the government purchasing services or outsourcing is going to soon become the only funding source for most of the organizations. So it's going to shape how the sector really looks like. Very briefly, just to make sure that it's data-based, the HIV case study is actually based on the studies that were done in Yunnan province, the larger studies that were funded by USAID, and they were done over the last 2 years in preparation for the transition from the foreign-funded system to a fully country-owned and country-funded system based on contracting. The method, we have done surveys of what we believe to be a whole population of CSOs, the autonomous NGOs, you could also call them, in the province. So we believe you have covered almost all of them, and then we have also spoken to 40 key informants at different levels. What we have found, first of all, CSOs, they already deliver a significant percentage of HIV services. The state is really dependent on them. Unless the health authorities hire a lot of staff, they won't be able to do it because the protocols have become extremely complex and sophisticated. And obviously, CSOs are also a way to reach out to target populations which are marginalized and difficult to find in the sector. There are different types of CSOs that have emerged. We have found different ways through which the CSOs engage with the government. So there are types that are, our classification is based on their capacity as well as on their relationship with the government. So we have found that quite a few, we call them groups of volunteers, they aren't even an organization. It's a group of target population that works with the government and is fully controlled by the government. Then we have CBOs that are more like organizations, but they differ in their level of autonomy. And then we have quite a few, 5 in Yunnan province, NGOs who are quite independent and who are able to set their own agenda and who are able to engage in a diverse set of activities and services. And I also like to talk about sectors and systems, because what we are seeing is also that these different kinds of organizations, they do interact with each other. So you have NGOs providing different kind of support to CSOs, networks, and we also have an umbrella gongo, which could also be called a hub. We have seen several cases of successful social innovation in the sector, and that has been under previous model of funding. This has been mostly visible with the NGOs, and there are cases when NGOs, seeing that the government service was not very effective, they have developed their own protocols, and they were able to influence the government at different levels to actually change the way that the government is doing its work. So in Yunnan, for example, there was a successful case with PMTCT, which is prevention of mother-to-child transmission, and their lessons learned, they were generated by an NGO that were taken up to even to the national level. There were also other cases of influencing the protocols of how to work with the gay population for testing, and then referring them to other services if they test HIV positive. So these were the NGOs, but interestingly, also the CBOs, so the smaller organizations at the local level, were able to get together major stakeholders at their county level and city level and engage in discussions about issues like stigmatization in the medical setting, or lowering the cost of the methadone treatment, or access for people living with HIV to the minimum living subsidy. And these were all successful cases. And more are described in the paper. But as I'm saying, this happens previously when the CSOs were supported technically and financially by foreign donors. There are also quite a lot of lessons learned from the pilot contracting program. So what we are seeing is they cover only basic direct services and they overlook more complex innovative services. That CSO's organizational development needs are largely neglected, and also that the pilot contracting strongly favors the dependent model of the state non-profit relationship. Basically, there are competition mechanisms for CSOs to take part in contracting, but they are competitive only in theory. There are ways to make them very uncompetitive, and they're actually quite easy. Conclusions. Cost efficiency is the primary motive for introducing contracting. That's especially relevant for the local level government, but I would say all levels as well. New funding environment based on contracting is likely to exclude and thus eliminate, because it's the only way of funding, the more capable autonomous CSOs. And because of that, I think there is a risk that contracting may result in CSOs functioning as extensions of local health authorities at the very lowest level, regress in the development of CSOs, organizational development, lack of policy feedback processes because there are no venues for it, lack of competition because of the way that selection processes are being set up. And in the long term, I think it's actually also undermining the purpose of the whole reform, because it might result in a negative impact on the quality and effect. Policy recommendations, I'm going really fast. Okay, so I know the paper was, it is about policy feedback, but as we were going through our case studies, we discovered that really policy feedback is a very important thing, but it's like a cherry at the top of a pie. So in order for this to take place, you really have to have quite a lot of things which will actually ensure that we are talking about CSOs as independent organizations. So we think that there is a need for financial and legal infrastructure to support the development of strong non-profit sector, and this can be really divided into recommendations for the outsourcing processes itself, as well as for the environment for the CSOs in general. So for the outsourcing, we do think that there is a need for central level and provincial level guidelines for the local governments on how to actually do outsourcing. And we do believe that these guidelines, they should include guidance on how to differentiate different kind of contracting, so that it doesn't only include direct services, but it also allows for social innovation and allows for other kinds of services, like, for example, larger NGOs serving smaller CBOs and government volunteers, for example, to build their capacities. It's also, and I think it speaks to Jennifer's paper, I think there is a need to differentiate levels of contracting, because these are very different relationships and different things should be contracted out at different levels. And core costs should also be covered through service outsourcing. Surprisingly, they are not. So the CSOs are not being paid for their venues, for their desks, for their computers, and so on. Yet they're asked to do a lot of work. Speaking about the general environment, obviously, yes, I'm wrapping up. Direct registration, but as we all know, and there are papers on it, direct registration itself does not solve the problem. You also need a larger supportive environment, and one very important issue is to allow the CSOs to fundraise beyond the government outsourcing, and this is actually quite difficult. Another great need, a need to build the capacity of both the government and the CSOs on how to actually engage in outsourcing. And then lastly, at the top of the pie, increase monitoring, evaluation, and learning. And this includes learning about the social services outsourcing in general as the programs are being rolled out, but also creating venues and mechanisms for policy dialogue, coordination, and feedback. We know it's possible. We already have the cases, but we do think that there needs to be an environment for it. Lastly, I would like to thank all the people that have contributed to the studies in Yunnan, as well as USAID who has funded the study. And I would like to thank you for being patient.